Everyone, so in the last video we treated diphtheria. So today we're going to be treating another topic known as glucose 6-phosphate dehydrogenase deficiency. So we'll look at the overview, the background, signs and symptoms, the etiology. So when we're talking about this glucose 6-phosphate dehydrogenase deficiency, it is basically an inherited genetic disorder that usually affects the ability of red blood cells to function properly. So it is caused by mutations in the gene, in the particular gene that is responsible for producing this particular enzyme, glucose 6-phosphate dehydrogenase. So this particular enzyme, glucose 6-phosphate dehydrogenase, it plays a crucial role in protecting red blood cells from damage caused by certain oxidative stressors. So people with this deficiency, they may experience episodes of hemolysis, that is destruction of red blood cells, especially when exposed to certain triggers like infections, certain medications or certain foods. So these episodes, they can lead to something known as acute hemolytic anemia, and this acute hemolytic anemia is a condition where the body's red blood cells are destroyed faster than they can be produced. So looking at the background of this glucose 6-phosphate dehydrogenase deficiency, it is one of the most common genetic disorders worldwide, and it affects approximately 400 million people globally. So the disorder is more prevalent in certain regions, especially in Africa, Asia, and the Middle East, and parts of the Mediterranean too. So the condition is an inherited disorder and is inherited in an X-linked recessive manner. So this means that it primarily affects males and it's passed from the mother to the son. So it primarily affects males, but females can also be affected if they inherit 2 copies of the defective gene. So the deficiency results in a lack of protection against oxidative stress in red blood cells, and this can lead to cell damage and it can lead to hemolysis. So the condition is typically asymptomatic, but episodes of hemolysis, they can be triggered by certain factors leading to severe symptoms. So looking at the signs and symptoms of this deficiency, they are primarily related to acute hemolytic anemia, and this may include fatigue or weakness due to the decreased red blood cells and oxygen delivery to the tissues. Then there will be paleness. There will be paleness or like yellowing of the skin and of the eyes, known as jaundice, and it usually occurs when hemoglobin from broken red blood cells is processed by the liver. So there could also be presence of dark colored urine, which occurs due to presence of hemoglobin broken down products, which is known as hemoglobinuria. So that's why we see this dark colored urine. Then shortness of breath or rapid breathing, and this is usually particularly due to the hemolytic episodes. Then dizziness or lightheadedness, which is a result of reduced oxygen, like as the red blood cells are being destroyed, the oxygen carrying capacity of the blood is reduced. So there will also be increased heart rates, tachycardia, as the body tries to compensate the lack of red blood cells. So the heart has to work 10 times more than usually. So there will be tachycardia. Then enlarged spleen, known as splenomegaly in certain cases, So the symptoms, they often occur after exposure to triggering factors like infections, medications, or maybe certain foods. Looking at the clinical presentation, so glucose 6-phosphate dehydrogenase deficiency, it typically remains asymptomatic, like I said before, in individuals who are not exposed to the triggers. And however, when these triggers are present, when this person is exposed to a particular medication, a particular food, or contacts a particular infection, so when these triggers are present, there could be some clinical manifestations like acute hemolytic anemia, which develops within hours of days to which usually develops within hours to days of exposure of these triggers. Then jaundice, due to the rapid breakdown of the red blood cells and the release of bilirubin in the bloodstream. Then fatigue, weakness, which may be severe depending on the extent of the hemolysis. And the dark urine, which is often a sign of hemoglobinuria, and which results from release of hemoglobin into the bloodstream. Then in rare cases, individuals may experience severe complications, like for example kidney failure, especially if there is very extensive hemolysis. So looking at the etiology, what actually causes this glucose 6-phosphate dehydrogenase deficiency? So it is caused by mutations in the glucose 6-phosphate dehydrogenase gene, which is located on the X chromosome. So this gene, it provides instructions for making the glucose 6-phosphate dehydrogenase enzyme. So it provides the instructions for making this glucose 6-phosphate dehydrogenase enzyme, which plays a key role in the pentose phosphate pathway. So this pathway is important for producing molecules that protect the red blood cells from oxidative damage. So usually individuals with this glucose 6-phosphate deficiency, they have an inadequate supply of this protective enzyme, and it leaves these red blood cells more vulnerable to oxidative stress, more vulnerable to cell damage. So that is basically what causes this. There's a mutation in the particular gene, and because of this mutation, this particular gene is very helpful for these red blood cells. And when there's a problem with this gene, it cannot help the red blood cells anymore, and then the red blood cells start to have the effects of this gene being defective. So looking at the triggers of hemolysis, so hemolysis in individuals with this deficiency, it is typically triggered by infections, like I said, especially like bacterial and viral infections, then certain medications like anti-malarials, antibiotics, and pain relievers like aspirin. So that's why most of the time they usually advise not to give anti-malarials to people with this condition, because they are basically making the matter worse. Because some anti-malarials, how they work is that they induce this oxidative stress, and then imagine giving someone this anti-malarial, you are trying to induce this oxidative stress, and then this person already has a condition where like the red blood cells are already experiencing this oxidative stress, so you are just making the matters worse. So in cases like that, in patients with this kind of condition, it's mostly not advised to give them anti-malarials, antibiotics like sulfonamides, pain relievers like aspirin. Then some foods, especially fava beans, they contain compounds that can induce oxidative stress. So like the same way with the anti-malarials, you are giving something that would even make the oxidative stress worse. So for this particular food, it should be avoided. The exposure to some chemicals and some toxins too also triggers this hemolysis. So now, looking at the risk factors, for the male gender, since this glucose 6-phosphate dehydrogenase gene is located on the X chromosome, so males are more likely to be affected because they have only one X chromosome. So looking at the family history, like a family history of this glucose 6-phosphate dehydrogenase deficiency increases the likelihood of you being affected. Then ethnicity too, like I said in the beginning, the condition is more common in people living in Africa, Mediterranean, Middle East, and Asia. Then also exposure to triggering factors like certain foods, certain medications increases the risk of developing these hemolytic episodes. Then infections, they can significantly increase the risk of hemolysis too in affected individuals. So looking at the anatomy and the physiology, so glucose 6-phosphate dehydrogenase deficiency primarily affects red blood cells, and these red blood cells, they are responsible for carrying oxygen from the lungs to the tissues throughout the body. So the enzyme glucose 6-phosphate dehydrogenase, it plays a crucial role in the pentose phosphate pathway, which generates NADPH, a molecule that helps to protect red blood cells from oxidative damage. So in individuals with this deficiency, the red blood cells, they lack sufficient protection against oxidative stress, leading to their premature breakdown known as hemolysis. So this usually results in anemia, whereby the body does not have enough healthy red blood cells to carry oxygen. So for the pathophysiology, the underlying pathophysiology of this glucose 6-phosphate dehydrogenase deficiency, it involves, one, the inadequate production of the glucose 6-phosphate dehydrogenase enzyme. Then two, the lack of this enzyme impairs the pentose phosphate pathway, reducing the production of NADPH. And without sufficient NADPH, the reactive oxygen species, that is the free radicals, they can accumulate within the red blood cells. And this accumulation of these free radicals, it leads to oxidative stress and oxidative stress or damage to the red blood cells, making them fragile and prone to rupture easily, which is known as hemolysis. So when the red blood cells, they break down, the hemoglobin is released into the bloodstream, leading to jaundice and hemoglobinuria, and potentially damaging the kidneys. So that is the summary of the pathophysiology. So looking at the diagnosis, how are people with this deficiency diagnosed? It is typically done through number one, blood tests. So blood tests can measure the level of glucose 6-phosphate dehydrogenase enzyme activity. Then DNA testing. DNA testing is done to identify the mutations in this G6PD gene. Then peripheral blood smear can be done too, which may show blister cells, like abnormal red blood cell shapes that are resulting from the oxidative damage. Then there's also something called reticulocyte count. So having increased levels of reticulocytes, which are immature red blood cells, it may be observed due to having this hemolytic episode. So if you have an increased level of reticulocyte count, it basically is an indication that you have this deficiency. So looking at differential diagnosis, that is conditions that could mimic this G6PD deficiency condition, like autoimmune hemolytic anemia, thalassemia too, and malaria too, or other infections that could lead to hemolysis. So they could mirror these same signs and symptoms as we see in glucose 6-phosphate dehydrogenase deficiency. So for the management or the approach considerations, so number one, the best management for this condition, or basically any other condition, infection that is known to arise based on like a particular trigger, like like for example now, like when I did the video of asthma, so most of the time asthma can be triggered by a particular allergen. So in this case, to avoiding this trigger is the most important management strategy, because if you avoid these triggers, like avoid these particular medications, these foods, these infections, it would prevent you from having these hemolytic episodes. And then looking at the treatment during hemolytic episodes, so during hemolytic episodes, the management could include like blood transfusions if the anemia is severe, then giving intravenous fluids for hydration, then oxygen therapy if the individual is experiencing difficulty breathing, then also management of underlying infections through giving appropriate antibiotics. Then another approach is giving the proper education and counseling, because most of the time people don't really know about this condition. They don't even know they have it. They don't even know their triggers. Even if they have it, they don't even know what they should not be taking, what they should avoid. So giving the proper patient counseling, advising them on the triggers that they should avoid, the medications that they should avoid, and also giving genetic counseling too may be beneficial for families with a history of this disorder. So for the prognosis, so most of the time individuals with this deficiency, they are generally good if their triggers are avoided. So however, the prognosis can be severe if the person is continuously exposed to these oxidative stressors and eventually has this acute hemolytic anemia. So most individuals with this deficiency, they usually live a normal life, and they are usually fine as long as they avoid their known triggers. So the best thing is just to know your triggers, know the certain things that you should avoid, and how to manage these hemolytic episodes effectively if they should occur. So in severe cases, and if hemolysis is left untreated, that's when it can start to lead to kidney failure and even death, particularly in young children. So that's basically the breakdown of glucose 6-phosphate dehydrogenase deficiency. Thank you.